Hello everyone, I'm Anas Al Ubaidi, and the title for this lecture or the topic for this session is um, chemotherapy and radiation notes within chapter 32 of Review of Hematology Oncology and Oncology Scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Chemotherapy and radiation therapy are foundational treatments in the field of oncology, playing pivotal roles in curative, palliative, and supportive care of cancer patients. These advanced treatment modalities target the malignancy directly or modulate the biological environment to retard tumor growth. For medical scribes in oncology, documenting the course, side effects, patient responses, and emerging complications of these therapies is a critical skill that supports care teams in achieving optimal patient outcomes. Chemotherapy involves the use of cytotoxic drugs that target rapidly dividing cells, making it highly effective against cancer but also associated with a host of systemic side effects, such as myelosuppression, nausea, and neurotherapy. Careful documentation must capture the exact regimen, dose administration schedule, patient reported side effects, and clinical responses to track both effectiveness and tolerability. As for instance, a scribe might note cycle 3 of ACT protocol administered on day 1. Patient reports nausea managed with ondansetron. Radiation therapy, on the other hand, uses precise beams of ionizing radiation to damage cancer cells, DNA leading to cell death. Unlike chemotherapy, which is systemic, radiation often targets a localized area. However, it can still cause significant side effects depending on the anatomy irradiated. Examples include skin burns, esophagitis, and pneumonitis. Scribes must document details such as the dose, measured in gray, target site, and acute or chronic side effects. For example, a note may read patient complicated 30 GY and 10 fractions to pelvis, reports grade 2 erythema without ulcerations. Without ulceration. Accurate documentation of chemotherapy and radiation therapy serves multiple purposes. Firstly, it aids in compliance with national protocols such as NCC and National Comprehensive Cancer Network guidelines. Secondly, it ensures transparency and continuity of care, particularly in multidisciplinary teams managing oncological conditions. Lastly, clear and thorough records are essential for prognosis discussions and legal accountability. Key points. Chemotherapy documentation. We'll start with treatment regimen and cycle details. Chemotherapy regimens must be meticulously documented due to their complexity and life-altering implications. Essential elements include drug names and doses, cycle and schedule, premedications. As in premedications, not antiemetic steroids or antihistamine given to prevent side effects. Example, dexamethasone 10 mg mg administered IV intravenously before to infusion, before the infusion and prior to infusion. And special requirements, for instance, hydration protocols for cisplatin to prevent liver toxicity or urine alkalization measures for ifosfamide. And here is a diagram showing the chemotherapy documentation process. Monitoring toxicities, chemotherapy impacts both cancerous and normal cells, leading to significant side effects that must be documented precisely. Myelosuppression include white blood cell, WBC, hemoglobin Hb, and platelet counts from follow-up labs. Example, WBC dropped to 2.5 times 10 to the power 9 per L post-cycle, gene initiated. GI gastrointestinal symptoms, not nausea, vomiting, mucositis, or diarrhea. For example, grade 2 nausea persistent despite ondansetron. Peripheral neuropathy often occurs with agents like paclitaxel or vincristine. Document onset and severity. Patient reports tingling in hands and feet, increasing in intensity after cycle 3. Patient reported concerns always include subjective symptoms and psychosocial impacts. Patient feedback about treatment tolerability and quality of life, poor appetite, increased fatigue reported, emotional health relating to cancer therapy, patient expressed anxiety about hair loss, referral to counselor made. And here is a diagram on chemotherapy side effect. Treatment adjustments modify and document based on my findings. Dose reductions required for toxicity management. Example, carboplatin reduced to AUC 5 from AUC 6 due to grade 3 thrombocytopenia. Schedule delays may improve recovery from adverse effects. Example, next cycle postponed by 7 days for ANC recovery. Understanding red flags. Severe complications warrant immediate escalation. Examples include febrile neutropenia, example fever of 101 degree Fahrenheit, ANC 300 per UL, empiric antibiotics initiated. Tumor lysis syndrome, example hyperkalemia, and acute renal failure, kidney failure after initiating rituximab. Tumor lysis syndrome. Um, Drug hypersensitivity reactions, for example, anaphylaxis with platinum-based agents. And here is a diagram on treatment adjustments and red flags in medical care. Radiation therapy documentation, dose and treatment planning. Radiation therapy documentation is precise and must clearly capture the treatment specifics, radiation dose and fractions, technique used, and treatment targets. Side effects by target site. Local effects depend on the irradiated area. Head/neck radiation, document mucositis, xerostomia, or dysphagia. Example, grade 2 mucositis. Patient reports difficulty swallowing solids. Abdominal/pelvic radiation, record bowel disturbances such as diarrhea. Chest radiation, pneumonitis presenting as dry cough or dyspnea. Always assign graded severity to align with documentation standards. For example, CTC-AE, common terminology criteria for adverse events. Patient positioning and safety protocols. Radiation is highly targeted, hence positioning is vital. Record use of immobilization devices. For example, patient positioned using thermoplastic mask, reproducibility verified for alignment. Not any deviations or adjustments made mid-course. Follow-up imaging and tumor response. Radiation efficacy is assessed through follow-up imaging, CT or PET findings. For example, post-treatment PET/CT shows 90% reduction in metabolic activity. Correlate clinical symptom reduction with radiological findings. Emergency symptom monitoring. Document acute toxicities requiring urgent care, radiation burns, not skin changes from erythema to ulcerations grade 3, desquamation, neoradiation field. Spinal cord compression, record findings like new onset weakness or incontinence. Summary tables. Here we have table on common chemotherapy regimens and documentation essentials, table on common side effects and chemotherapy and interventions, table on radiation therapy modalities and clinical applications, table on key monitoring protocols during treatment, table on red flags in chemotherapy and radiation therapy. And then next we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. Which of the following should always be included when documenting a chemotherapy regimen? A. Patient's dietary intake during treatment. B. Drug names, doses, and administration schedule. C. Emotional reactions to diagnosis. Or D. Wait to the nurse administering the drug. And the answer is B, definitely. Drug names, doses, and administration schedule. As documenting the exact drug names, dosages, and schedule is crucial for chemotherapy regimens to ensure accurate treatment, tracking, safety, and continuity of care. Question 2. What side effect is most commonly associated with cisplatin that requires careful pre-treatment measures? Is it A, peripheral neuropathy, B, neurotoxicity, C, severe alopecia, or D, tumor lysis syndrome? So 4 of them are common side effects or complications for chemotherapy. But which one particularly linked to cisplatin would be B, neurotoxicity, kidney toxicity, or renal system toxicity. Cisplatin is known for its risk of kidney damage, neurotoxicity. Pre-treatment hydration and monitoring of renal function are essential to mitigate to manage this risk. Question 3. When documenting radiation therapy for a patient with head and neck cancer, which detail is most critical? A. The patient's family history of cancer. B. The technique used, for example, IMRT and radiation dose in gray, GY. C. The presence of hair loss during treatment. Or D. The timing of their last dental visit. The answer is B. As accurate documentation of the radiation technique like IMRT and the total dose in gray is essential as this data is pivotal for treatment planning, monitoring side effects, and assessing outcomes. Question 4. Which symptom documented in a chemotherapy patient requires urgent intervention? A. Tingling in the fingers after 2 cycles. B. Fever of 101.5 degree Fahrenheit with ANC less than 500 per UL. C. Fatigue lasting 1 day after administration. Or D. Mild nausea controlled with antiemetics. Is B. The answer is B. Fever is in a neutropenic patient is indicative of febrile neutropenia, a medical emergency requiring immediate antibiotic therapy. Question 5. Why is routine imaging important for patients receiving radiation therapy for lung cancer? A. To measure their weight loss during treatment. B. To confirm proper patient positioning during radiation. C. To assess tumor response and detect metastasis. Or D. To document hydration levels before prior to treatment. The answer is C, as imaging such as CT or PET scans is performed to monitor the response of the tumor to radiation therapy and check for any signs of separate. It ensures that treatments are effective and may dictate further therapeutic decisions. And here we come to the end of this lecture. Thank you very much and goodbye.